KE Suriname BV, Shell Suriname, heeft gisteren een speciale apparatuur aan het Lands Hospitaal overhandigd ten behoeve van de neonatale zorg. Medisch directeur mevrouw Dr. Sunita Nanan Pandey Gopising gaf bij deze gelegenheid aan de donateur mee dat zij een deel zijn van een grote puzzel.
We started to put together the puzzle in 2020 with the idea of a long existing wish of a neonatal high care unit for our babies who are born with complications preterm and who need some special care the first weeks of life. So that puzzle consists of various parts, and one part is all parts are important, but without medical equipment you cannot take care of these babies. So you are now today part of putting together every medical equipment that is needed for the department, and other parts are the technical electrification, generator, and the last part is the building where the ward will be installed. When we asked this donation to Shell, we didn't have the financial means for the building and the other parts of the ward, but then came Minister of Health, and with the good news that the Ministry of Health through the Ministry of Finance will help us with the financial means for setting up and building the ward. So that was a big step forward. In the meantime, we were gathering all the needed equipment, and we got the approval for the equipment that we are being handed over now with the help of Staatsolie, also welcome. And so today we will get one baby incubator, and this is called a neopuff equipment, and I will give some explanation. The one incubator is part of four incubators we need for the department. So 1/4 is given to us today, and also the neopuff equipment is part of 4. Every baby bed needs such equipment. So this is one of the 4. So the part of Shell is very, very important. Without these donations, we are not able to level up our care.
De directeur van het Lands Hospitaal, Dr. Sankar Mathura, gaf aan hoe de donatie tot stand kwam.
So this request for medical equipment was addressed to Shell through Staatsolie, and this is a donation for other highly needed medical equipment, as you have heard, for our new medical facility, which, as you heard, now in construction, named the neonatal high care unit. In August 2021, Lands Hospital opted for this equipment for the neonatal high care unit, which should be approved by Staatsolie before it could be sponsored by Shell Suriname. And the finally approved list of 25 of August 2021 included the following items: Draeger Isolate Baby Incubator, as you have heard, with a value of $20,560.80, and a neopuff resuscitator system for the animation of neonates for $4,318.58. Total amount of $24,879.38. That's the sponsorship. As we already have received all good items in good condition and state from Harson's Meditech, who is the company that delivered the equipment, we are here today for the ceremonial handing over of the donated medical equipment. Thanks to Shell, we have made another step ahead for the realization of the new neonatal high care unit in Lands Hospitaal, which will build a highly needed medical bridge between our neonatal medium care and the neonatal intensive care, the NICU of the academic hospital. This project will facilitate 4 neonatal high care beds in our hospital with full equipment and will offer medical care for neonates at least for the first 48 hours if needed. This is a must for Suriname. I know that there is a lot of discussions going around of Lands Hospitaal should be established such a facility as a general hospital, but due to the lack of capacity in the NICU of the Academic Hospital Paramaribo, this neonatal high care unit will be one of life savings for neonates.
Andrew Hepburn, country chairman van Shell, gaf aan waarom zij deze donatie doen.
So regarding health and this project, so today at least half of the world is unable to access the treatment that they need in terms of healthcare, and that's according to the World Health Organization. And in too many countries, healthcare is either limited or not adequate for requirements. I think we all know and recognize the importance of tackling the infant mortality rate, but also in helping to give newborns the good start in life that they deserve. And I think that's what really gives rise to this project. In 2020, Lands Hospital approached Cosmos Energy at the time to assist them in upgrading their medium care and high care facilities and neonatal units. They informed of the importance of the number of newborns with life-threatening birth problems and informed of that rate, which was increasing at a rate which at that time was concerning. This was one of the projects which we as Shell took over from Cosmos Energy at the time of the acquisition. But I think it was a very important project for us, and we recognised the commitment towards supporting healthcare in Suriname, and we agreed that this was an incredibly important project and indeed life-saving. So for that reason, we welcome the opportunity to make a contribution towards the modernisation and upgrade of the neonatal facilities. This donation specifically was at an estimated cost of about $25,000. And in Shell, our social investment and our commitment is really to help in terms of social economic development, sustainable progress in terms of people, environment and community. And I think ensuring the health and the well-being of infants and children are some of the most important investments any country can make. So for that reason, I think we wish to also applaud the Ministry of Public Health and Lands Hospital for their commitment to ensuring child survival.
Minister Amar Ramadien van Volksgezondheid kan zich terugvinden in de ondersteuning van Shell aan de volksgezondheid.
I can fully agree, and I'm fully aware, and also I can agree on the view of Shell in how to support the community, how to support the people, how to support the different sectors, and it is from us as government very important also that you are guaranteed that the investments and the donations and contributions the company will provide will be in good hands and with a very sustainable plan. That's why the Minister of Health, after the COVID-19 pandemic and in between the COVID-19 pandemic, we started with creating a reform plan. And the reform plan based on the actual situation of the health system, the health infrastructure, the needs and the different challenges within the health sector. And therefore we have created the reform plan in which the hospitals, in which all stakeholders participated in engaging and in also creating this reform plan. And in the reform plan, we are trying to approach more comprehensive, more integral approach of the different challenges within the health sector. And one of the challenges is absolutely the investments in health the investment in infrastructure, in health, equipment, in the care, in improving the access to care, in improving the quality of care. So that's why I see Staatsoli here. Staatsoli has already received us from the reform plan for a presentation, and I must also immediately say thanks to Staatsoli, which has been the first company to really be aware and also be convinced of the reform plan and the benefit of the reform plan in the implementation. And Staatsoli has contributed also a very significant amount of financial resources to the reform plan.